As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united. Get vaccinated. So together, we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
Pagplano ng pamilya, hawak ko sa iyong kamay. Kaya pumili na. Hindi na ako matatakot, dahil handa na ako. Hindi na ako kabado, anuman ang marating, sa tulong ng family planning. Alam kong kaya ko,
walang takot at kaba. Pag may plano, protektado.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Umistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solusyon sa COVID-19.
Hello and good evening, everyone. Welcome to another episode of Happy Hour for Mental Health, brought to you by, of course, Alaga Health and, of course, our partners from the Youth for Mental Health Coalition, Quarantalk Media, 2030 Youth Force, Experto, PlayLabs, and so many other amazing partners. And, of course, dahil Friday po ngayon, nako, ito na naman po yung gabi kung kailan kayo pwedeng magtanong ng kahit na ano tungkol sa mental health. A dedicated show po ito sa lahat ng concerns about our mental well-being, paano aalagaan to, anong pwedeng gawin kapag hindi masyadong maganda ang pakiramdam, and of course, consult for free with our health professionals. And without further ado, let me introduce to you my co-hosts for this evening. First and foremost, let us all welcome our primary care health specialist, none other than from Alaga Health, Dr. Jucille Roderos. Good evening, Doc Via. Welcome to Happy Hour and welcome back. Is she back on the show? Just a very quick check. 5, 4, 3, 2, 1. It looks like she's having a little bit of technical concerns. Maybe then we can jump to our beloved superstar psychiatrist. Ayun yung tinatawag ng celebrity psychiatrist. So our superstar psychiatrist, none other than the one, the only, Doc Joan Perez-Rifareal. Good evening, Doc Joan. Very quick check. 5, 4. Yeah, there she is. Perfect. Hi, Doc Joan. I hope you are well. And it looks like she might be having a bit of technical difficulties. Nako, that's one of the major concerns talaga when it comes to having live shows. But don't fret, because we will be joined tonight, by someone who is, I think you all know her, a representative truly of mental health advocacy. And she currently is a certified coach of the National Youth Coalition's Mental Health Youth Hub and one of the most in-demand speakers ng ating generation when it comes to mental health. And you saw her break the record of this show with 17,000 views the last time she was on. So coming back, none other than the one, the only, Coach Ymari Pascua. Hi!
Hi everyone! Isang napakagandang gabi sa ating lahat. Ilang araw na lang patapos ng World Mental Health Day, but I'm here and excited to talk about mental health with everybody.
Perfect. Thank you so much, Ymari. And nako, I think she's okay na. Let's bring back to the show Doc V. Hi, Doc V. Are you with us now? Perfect.
I was on mute, no? Kaya nang sabi ni Doc Dex kanina, yun yung mga problems when we have, or challenges rather, that we have when we have an online talk. No? But the show must go on. No? Again, good evening po sa ating mga viewers. And of course, sa lahat po ng mga nag-aabang po, and then and to all our avid supporters po. Salamat po ulit sa pagsali po sa amin dito sa Alaga Health Live. I know that this is an episode wherein we have a lot of guests, and we have a lot of amazing topics that are in store for you today. So we're very excited personally na makasama ulit namin kayo sa isa na namang masayang kwentuhan dito sa Happy Hour.
Perfect. Thank you for that, Doc V. Sige, I think before we move on to our first segment, let's also try to say hi, because returning to this program is none other than, after a bit of a hiatus, coming back to the program is none other than Miss World Beauty with a Purpose, Miss Joy Barcoma, coming back to host the segment of Y4MH. Hi, Joy. Welcome back to the program. Our live after your live kanina. Hi. So we have
Yeah.
Perfect. So thank you for joining us. And since you're here and Ymari is also here, I think it's time to have our very first segment, which is, of course, our Kwentong Happy Hour. All right, so this is Kwentong Happy Hour. And of course, let's try to get some good vibes going, no? So, try natin ibalik si Joy for a very quick segment lang. So, I'll go around the room and ask everyone, can you share with us some happy news that probably you heard about or probably happened to you or your friends? So, ikot tayo. Let's start the show on a positive note. Let's start with Doc V. Any good news na dumating sa iyong life this week? Or may narinig ka news about Philippines or anyone na talagang nakapagpa-spark ng joy for you?
So one of the things that we want to celebrate, no, is good health, no, and especially since we are nearing the end of Mental Health Month. No, let's not forget what the significance of this month is. Ano po ba yung kahalagahan ng month na ito, no? So what's important is we have to embody, no, the values, no, and the significance of Mental Health Month. And hindi lang po nagtatapos ang advocacy natin sa Mental Health Month ngayong October, no. Every month is Mental Health Month, no. So let's try to celebrate mental health and our health, good health, no, every day, no. And of course, no, I think I'd like to congratulate, no, and I hope na Doc Dex hindi ka mabigla, no. I'd like to congratulate Doc Dex. He actually was recognized, no, as one of the outstanding health leaders, no, and he's on his way hopefully to Dubai next year, no, to receive his award. So congratulations, Doc Dex. Your Happy Hour family, your Experto PlayLabs family, and of course your Alaga Health family is very proud of you, no? So congratulations.
Thank you so much, Doc V. No? So, okay, yun na yung happy news ko. Siguro this week, I won't share na. That would be the highlight for that. Pero talan tayo kay Ymari. Ymari, any happy news coming out from this week's roster of events? Ako, si Ymari mo kasi, kung di niyo mo alam, filled to the brim sa sobrang dami niyang speaking engagement.
I think we lost Doc Dex and Doc Pia, no? Because it's really hard to connect with our internet here in the Philippines. So we're having, technical difficulties. So welcome back, Doc Dex.
Welcome back, me.
Well, we've been waiting for your line, no? Before Ymari gets to talk about her happy moment this week.
Of course. So I was going to ask kayo ni Ymari, any happy news for you this week? Kasi si Ymari, talagang bumabaha ang speaking engagements and ikaw sunod-sunod din ang live talk. So any news coming from your end as we end Mental Health Awareness Month? So let's start siguro with Ymari.
Ayun, siguro happy news is number one, I'm still alive despite all of the challenges that we are experiencing. And yun, Kuya Dex is right, no? We are very grateful and humbled naman to be invited to different organizations, lalo na this Mental Health Month. Pero, again, hindi natatapos yung pag-advocacy natin para sa Mental Health Month tuwing October lang, no? We do it every day, every month, no? Hanggang matapos ang buhay natin, we will advocate for mental health. So, yun yung things that made me happy this week, Doc Dex.
Perfect. And of course, one of the most in-demand voices ngayon for mental health, Joy. Any happy news coming from your end naman?
Thank you, Doc Dex. But before I share all my happy moments this week, I just want to congratulate everyone for being alive, for keeping alive, and for staying alive. Doc Dex, congratulations on your award, and good luck sa pagtanggap nito next year. Doc Dia, thank you so much also for spending your time with us every Friday here on Alaga Health, and of course to Ymari for sharing her knowledge and expertise when it comes to mental health. So as for me, I just want to take 3 things that I'm really grateful for this week. So First is that we are opening more conversations about the upcoming elections, and I think it's just healthy for us to be able to talk about that, no? Because, one of the factors about mental health is to also look for our future leaders that will take care of our society and our community. Kasi isa yon sa magiging factor in building a strong foundation, no, for our health and for our healthcare system. Second is that I'm really happy that some communities, schools, workplaces are now open to speakers like me and like Ymari, and of course like you, doctors, when it comes to talking about mental health awareness, and not just awareness, but really engaging and educating to young people, to of course people of workplaces, people of school, to be able to really grasp the idea and the importance of mental health. And as per me, I was able and I was granted a lot of opportunities after winning the Beauty with a Purpose Award from Miss World Philippines to really further our cause in championing mental health. So I think those are the things that I'm really thankful for and grateful for, and that made me happy. And of course, happy, Mental Health Month to everyone.
Perfect. Nako, spark joy. No? So, let's now bring into the program. I think she's already back, no? Pakakahabol siya ng pag-share ng happy news. Let's bring back to the show our superstar psychiatrist, none other than Doc Joan Rifareal. Welcome back, Doc Joan.
Hello! Good evening to everyone. Good evening, Dr. Dex, Dr. Via, Ma'am Ymari, and Ma'am Joy. Good evening po sa lahat, and to everyone po na nanonood. I am so sorry I was late again. Talagang busy po ngayon kasi again, we are celebrating the World Mental Health Month. Kaya ang daming ganap for mental health. So, daming ganap for mental health. So, kamusta po? Kamusta ang lahat ng ating mga viewers po at mga nanonood? I hope everyone is safe and everyone is healthy and well.
Yes, Doc Joan, we were just sharing happy news as a kwentong happy hour segment tayo, Doc. So we're asking kung ano yung happy news that happened to you personally or narinig nyo over the past week. Kasi alam ko si Doc Joan, nakita ko sa Facebook, ay si Doc Joan, nag-happy day nila ni Doc Noel. Kinikilig naman ako bigla. So,
Doc Nolly, Doc Dex.
Nolly, Dex.
Nolly.
Oo, baka akala, kung sino kaya yun si Noel? Nolly.
Nolly.
Oh, yes. Finally, nakalabas
baka pagalitan ka ni Doc Nolly, Doc Dex. Sino si Noel?
Uy, di friends na sila sa Facebook.
Yeah. Super supportive lang ni Doc Nolly. Parang siya nanonood ng Alaga Live.
Super. Hindi ko pa lang sila na-message ngayon kasi as in, kakaupo ko lang talaga and then diretso because may inaayos lang kami. But yeah, very happy kasi I'm very happy kasi para sa mga anak ko na 12 to 17, so di ba may anak akong 17, may anak ako 17, meron na silang bakuna starting November. So that's a happy news, di ba? At least kasama na ang mga anak namin kasi mga namin na mga younger than 18. So that's really very good, 'di ba? Kasi at least kasama na sila sa mababakunahan simula November.
Yan. Perfect.
Yay.
So thank you for that, Doc Joan. So we'll now actually be jumping into the questions. We will see Joy for her special segment during the latter part of the show. So we'll see you in a bit, Joy. Bye. And let's now jump into...
Congrats, Joy. Oo.
Yes. Beauty with a Purpose.
Oo nga. Yes.
First time yung bumalik, Doc, after the event. So ngayon, we're happy to have her back for her segment. But for now, we'll now tackle the questions. So our first question here from the Alaga inbox, redacted yung last name per her request. So this is her question. So let's jump into it. So, ang question is, hello Alaga Health Docs. I've been struggling with weight issues for as long as I can remember. It got worse since the start of the pandemic, and I think it's taking a toll on my mental health. Nako, something that might be very relatable to a lot of our viewers, no? Kasi especially ngayong pandemic, ang dali na lang umorder ng food, nasa bahay ka, you don't get to do exercise, especially kung dati kang gym buff. So, any quick responses? Siguro we can do a quick one. So, maybe Doc Joan and maybe Ymari and Doc Via can add.
Yes, yes.
Yes,
Oh,
Doc.
I understand. Talagang very ano ito, very Francine, Ma'am Francine, talaga it's really understandable. Kasi kung dati tayo ay tumatakbo papuntang school, papuntang work, para wag tayong malate sa mga flag ceremony, wag tayong malate sa ating trabaho. Ngayon kasi with work from home or online schooling, talagang nasa bahay na tayo at nawawala yung physical activity, movement is very limited now kasi lagi nakaupo in front of the screens, etc. Mas maganda po, meron talaga siyang impact, no? In fact, when we gain weight or when we yung nag-change ang ating eating patterns, pwede kasing yung iba ang coping skill nila is to nawawalan sila ng gana or kain sila ng kain, no? Eating comfort food at with the physical inactivity, so nag-gain talaga ng weight. So mas maganda po, I suggest po ma'am, physical activity is very important. Kaya po ang pillars lagi po ng ating physical health, which is really, may intertwined din siya with our mental health, is to eat well, eat healthy, yung mga healthy, mas bawasan po natin yung mga not so healthy, na mga low in nutritional value. At of course po, physical activity, very important. Exercise, hindi naman kailangan gym levels ng exercise. Hindi naman. Kahit na gardening, basta any activity na gumagalaw-galaw tayo, like gardening, playing with our pets, nagsi-stretching, or nagda-dancing, di ba? Usong-uso ngayon yung mga apps ngayon na sumasayaw-sayaw. Any form of physical activity can really boost our mood because of the endorphins na nare-release when we do galaw-galaw. Kaya sabi nga, galaw-galaw para hindi sabaw. Di ba? Ganun yun. So, kailangan galaw-galaw tayo for blood circulation.
I like that. I'm going to sing that.
Yes. Yeah. So, yes po. So, let's do
I love that. Coach Ymari, Doc Via, anything to add? Gusto ko yung code. Galaw-galaw para hindi sabaw. Okay, got it. I'm gonna start using it. Okay, Coach Ymari and Doc V.
Gusto ko yung sinabi ni Coach Joan po, no? Galaw-galaw. Tama yun. Katulad ni Francino, I've also experienced anxiety because of my weight. So, nung college ako, sobrang payat ko. But because of certain stuff na nangyari sa buhay natin, and syempre we're getting older, medyo nag-a-add din tayo ng weight. So, it's not normal, no? Na magkaroon din tayo ng natin. And yun, gaya ng sinabi ni Doc Joan, no, lalo na ngayong pandemic, ibang klase yung pagiging addict natin sa Food Panda, sa Grab, no? Palagi tayo nagkakain. Even ako sa kwarto, no, meron akong snacks na naka-prepare for midnight. So, ayun, pero that doesn't mean, no, na nandito tayo sa bahay, hindi na tayo kikilo. So, let's try kahit very minimal lang. Let's try to stretch. Let's try to download exercise apps. Sumabay tayo sa YouTube, no? There are a lot of ways para matulungan yung sarili natin kahit pa konti-konti, no? Kahit small steps, no, that will be a long way for us in the future. So, yan. Take small steps at a time.
Yon, thank you for that, Coach Ymari. No, siguro we can jump to our next question na si Doc Via yung ating tanongin for input. Kasi ito ay nanggagaling galing kay Sir Weng Paterno. Galing kay Sir Weng Paterno. Magandang araw po. Madalas pong paiba-iba yung tulog ko. Minsan buong maghapon ako tulog tapos buong gabi gising. Paano po ba mabalik sa dati? Okay. I think Doc Joan, napapansin ko, almost every session, meron at least isang tanong about not being able to sleep well. Either hirap matulog sa gabi, o kaya naman laging puyat or sira yung sleeping patterns. Any thoughts on this? Then maybe Doc Via can add po.
Yes. In fact, tama talaga, no, Dr. Dex, kung hindi tulog, it's about kain or exercise, di ba? Kasi itong tatlo kasi, tulog, eating patterns, sleeping patterns, and our physical activity. Ito yung pillars ng ating physical health, physical wellness, and in fact, yung physical health kasi intertwined talaga siya with our mental or kalusugang pangkaisipan, no? Mental health. So, with this naman po, ang understandable also. Lahat kasi ito, all of these changes now, due to changes ng ating routine. Nawala kasi yung dating routine natin, na halimbawa, 8 to 5, nasa trabaho tayo. And pagka 5 o'clock, uuwi ng bahay, sasakay na tayo, uwi ng bahay, dinner, matulog. Ngayon kasi, with the work from home, sometimes nag-change na ang routine, na wala na yung exercise sa umaga na tumatakbo tayo sa EDSA para mag-catch ng bus. And then sometimes, flexible ang oras. So, nagiging flexible. So, pwedeng, ngayon kasi, ang alam ko is parang hindi na talaga siya strict talaga sila, no, na 8 to 5. Basta, ang important is that natatapos nila ang kanilang mga output or deliverables. So, sometimes, nagkaka-change talaga sa circadian rhythm kasi yung iba naman, sa gabi sila mas awake at doon nila nagagawa yung kanilang trabaho. So, sa umaga, binabawi nila ang kanilang naps or tulog. So, that's why po, mas maganda ibalik natin kung kaya ang ating natural na circadian rhythm. Mas maganda kung magnanap tayo sa hapon, wag yung buong hapon tulog tayo. Kasi talagang it will stretch kasi yung number of hours ng tulog. So pagdating ng gabi, hirap na tayo talaga matulog.
Agree. Actually, Doc V, any... Yes, Doc. Continue po, Doc.
Wala. Okay lang.
Okay. Doc V, anything to add kay Doc Joan? Ako, sleep talaga big concern during this time.
Okay. I think one of the things na nabanggit, ang daming nabanggit na good points ni Doc Joan, especially how sleep actually is affected by our what we eat, no, our routine, lahat po ng nangyayari po in our everyday activities, no. So maybe what I can add, no, pwede ko madagdag dun sa sinabi ni Doc Joan, no, especially in terms of yung work from home arrangement, no, school learning from home arrangement, no, is to be able to have at least, no, to normalize or establish a routine and an everyday routine, no. Like for example, in the morning, no, you do your quick exercise or mag-meditate or you pray, no, and then after that, set up a schedule for your meals, no. Especially if meron naman pong set schedules for your work from home arrangement, for your school, no. And of course, it's actually important for us to take breaks, no, for our own well-being, especially since ang daming nangyayari in a day, especially with a flexible schedule, ang dami mong pwedeng i-pack dun sa day mo, no, na dahil work from home naman ang lahat, no, you might have that tendency or no, that illusion na marami kang pwedeng gawin. No? That's why we have to set the routine to pace ourselves, no, and that actually helps us, no, have that certain regularity pag gusto na nating matulog, no? Nagkakaroon, our body falls into that habit, that healthy habit of having a schedule for everything. And especially it's important, no? And I think I mentioned this before, no? Probably maganda, Doc Dex, na meron tayong episode talaga lang for sleep, no? Especially how it affects our mental health. Ang dami talagang questions, and then it's actually very evident, no, in everything that we encounter pag mental health, no. So it's important, no, to keep ourselves relaxed when we sleep, no, have an environment na dark, no, or medyo dim talaga yung lights, no, to help you fall asleep.
Yan. Yes, Coach Ymari, any advice? Ano yung ating mga usually binabanggit na sa ating mga coaching sessions? Kasi ngayon, lalo ang daming gadgets, ang daming distractions.
Yeah.
Yes.
Yeah, yun po yung sasabihin ko. This one naman really helps me, no? Kasi tama si Doc Joan, lalo na ngayong pandemic, no? Nasanay tayo na nagsasabi na isang episode na lang pag nanonood tayo ng Netflix or whatsoever. O pag naglalaro tayo, palagi natin sinasabi, isa na lang, isang level na lang, isang episode na lang, whatsoever. So this one really helped me, no? So we can also try it. Let's try to lessen our screen use, no? Let's limit our phone time, lalo na paggabi. If kaya natin, no, ilayo natin yung phone natin na malayo sa atin para tama rin na tayong tumayo at kunin yon. Kasi pag more na nare-reduce yung eyes natin sa light, mas nagiging awake yung brain natin. So yun, small tip lang pero it really helps.
Nako, authority talaga dyan si Coach Ymari. Sa lahat po na nakakaalam, she is also co-founder of Introspect na talaga ang it's an organization that focuses more on mental health advocacy, focused on social media management kasi ang laki na ng impact nun sa ating daily routine. So thank you for that, Coach Ymari. No? So before we move on, maybe it's time to have a very, very quick segment and have our Alaga Health update. Yan. So what you just saw is the brand new ad of Alaga Health, especially na our clinic managers are ready, our accounting system is included. So many things included within the system na free of charge. And ang maganda, no subscription fee, download for free. Pakita ko sa inyo yan how easy it is to sign up sa Alaga Health. So I'll just share my screen very, very, very quickly para makita nyo how quick and easy it is for you to become part of the Alaga Health family, whether you are a patient or you are a health professional. No? So pakita ko siya sa inyo right now. Now, if you're going to look at the screen right now, ito yung Alaga Health website. Ang ganda ng bagong layout ng ating show. So yan, makikita nyo siya. You can browse through it. You can even see the rest of the website, no? Even some of our advocacy partners that are there. And then all you need to do is press sign up. So you actually time, no, how fast it would be for you to sign up. Just click that button. It'll transfer you to another part of the website wherein you will get to choose patient, partner, or admin. So for example, sa mga pasyente po natin nandito, click yung patient app so that you can register. Check niyo yung sa data privacy. Of course, read through it, ensure this is checked, and then just press continue. You can just fill in your details, less than a minute or two, and then just input your safe password, and then just press continue after, and then voila! You're already part of the Alaga Health family, and you'll just have to click the verification button that will be going to your email, and then tapos na. And ang maganda po, you can even download the beta version already here sa ating Google Play Store. And of course, for health professionals, download din yung ating Alaga Partners platform na magkakaroon din ng web version na inyo pong pwede nang magamit for your clinic management and even your accounting system all in one. So, nako, anyone now can monitor what's happening in their clinic, whether they are on the go or currently at work. So, balik po tayo ngayon to the questions in the program. So, let's go to the next one that we have, no? Our next question is coming from Ma'am Melanie Cordova. Ang tanong niya, yung anak ko po parang naririnig kong kinakausap yung sarili paminsan-minsan. Hindi ko alam kung dapat na ba akong kabahan. Hindi ko rin alam kung paano ko itatanong sa, I think this is kanya. So, nako, hindi ko alam kung ano yung kwento behind this, Ma'am Melanie. Baka narinig mo siya sa kwarto, no overhear mo, or ano exactly yung sinasabi niya, or baka nagsa-self-prep talk lang siya na, kaya mo yan, let's do this, or it's something else, di ba? So, for Ma'am Doc Joan, any quick advice that we might be able to tell her? Kasi parang hindi na niya alam kung paano niya approach.
Correct, correct. Yes, hello, Ma'am Melanie. Good evening to you. Ang maganda sana, ang kulang na info here is yung age ng anak niya. Kasi meron also na tinatawag tayo na imaginative play ng mga bata. Ito yung time na nagpe-pretend play sila and because very curious sila, ang imagination nila can run wild during play. So, normal, no? And for adults naman po, yes, it can also be normal po na pag minsan kinakausap natin ang ating sarili as a form also of coping. Yung iba, kinakausap nila na parang kaya mo yan. Parang inaano nila sa sarili nila, parang in-empower nila or inaano nila, pinupush, minomotivate ang kanilang sarili na kaya mo to self. Kaya mo tong i-hurdle ang exam, kaya mo tong gawin, etc. So, kulang lang tayo sa age dito, anong context siguro, Ma'am Melanie. And ang important lang is to monitor na ito ba ay napapansin ba natin na kinakausap natin niya ang kanyang sarili na iba na po, no? Parang nag-iiba na po ang behaviors involved, iba na rin po ang kanyang self-care, for example, has been affected or affected na rin ang kanyang role as a student ba or as a young adult, naapektuhan na ba because of this time spent sa pakikipag-usap niya sa kanyang sarili. Paminsan-minsan pala nakalagay. Ano? So, ano lang po, monitor, but it can be normal. It can be normal po.
Yan, very important talaga yung component ng age, no? Kasi doon malalaman yung mga behaviors that can be linked to that particular period of time sa kanilang buhay. Pero kung medyo mas older, tapos may mga ganito, I think maganda talaga na i-monitor natin and observe palalo. And kung continue siya, maybe we can consider consulting already. So anything to add siguro? Ano yung mga advice? Kasi feeling ko may mga nagtatanong na ng ganito sa Mental Health Youth Hub ng NYC. Anong usually yung mga recommended na ginagawa for at least that part ng ating mga mental health coaches, Coach Ymari? Ano yung usually nababanggit natin?
Thanks, Doc. So, hi, Miss Melanie, no? So, first of all, no, gusto kong mag-thank you sa'yo because you are concerned sa anak mo, no? That you are aware of the things that are happening dun sa anak mo, yun. Tama yung sinabi ni Doc Joan, no? First, I won't assume, I won't judge kung bakit nangyayari yon. But there are times that normal po yun, no? Ako, ginagawa ko yon. I do self-affirmations, no? Minsan, tumitingin ako sa salamin, kinakausap ko yung sarili ko, kaya mo yan, konti na lang, self-affirmations for me to get through the day. We can talk to our child or to our, sa anak natin, no? Pero let's not try to scare them. We can do it in a very gentle way. Pwede natin tanungin kung sino yung kinakausap nila or ano yung sinasabi nila, paunti-unti. Pero let's not quickly jump to conclusions that this is something that we should worry about.
Yeah, thank you for that, Coach Ymari, no? Maybe we can now jump to the next question kasi parang something similar yung vibe, no? This one is coming from Ma'am Mary Chris Fuentes. So it says here, simula po nung namatay yung asawa ko last December, naging matamlay na po yung anak ko na parang ayaw na po niyang bumalik sa trabaho. Ayaw naman po niyang mag-resign kasi magiging pabigat daw siya. Lalo po, tuloy siyang nalulungkot. Feeling ko tuloy yan. Tuloy siyang nalulungkot. Ano po kayang pwedeng gawin o sabihin? Ako, another concern, ang natutuwa ako dito sa questions na dumating sa atin is mga nanay ang nagtatanong tungkol sa kanilang mga kids, which is overwhelmingly good for me to see kasi ang ibig sabihin, aware sila na possible may mental health needs yung kids nila and that they are very much willing to help. So, kinikilig ako ng konti. So, siguro tanong tayo kay Doc Joan and we can ask Doc Via.
Yes, thank you very much, Ma'am Marie Chris, for your question po. First po, December, so parang wala pang 1 year, no? So, of course, from Alaga Health family po, we send our condolences to you and your family po sa passing of your asawa po. pag ganito po, no, natural po na we go through a grieving process na tinatawag po natin, yung pagluluksa, which is normal po, and I think yung napapansin po natin sa son po ninyo, sa anak ninyo na matamlay po siya, at parang ayaw na niyang bumalik sa trabaho, it can be po na he or she is still going through po itong pagluluksa, kasi ito po ay proseso po kasi siya na hindi natin po pwedeng madaliin, wala rin po siyang right or wrong way ng paraan po para i-process po, no? So hindi siya parang mabilisan, no magic formula, walang right or wrong way ng pagluluksa or to express our grief. Ang important lang po is we are always there po, no? We extend or we reassure ang ating mga family members na magtutulungan tayo pag nitong time na very challenging and difficult for the family po. Mas maganda pa rin po sama-sama always, and let your child know po na if he or she needs you para makausap ka po as part ng grieving process niya, na may nakakausap siya, meron siyang napagsasabihan ng kanyang emotions and thoughts about the passing po ng kanilang parent, then mas maganda po na we reassure them na nandito kayo lagi. And maganda rin po also na bigyan po siya ng time to also process po yung emotions niya. And again, monitoring also is very important, kasi sometimes po, pag napapansin natin na talagang, halimbawa, kailangan to take a break na muna, baka papayag naman din po, no, yung kanyang pinapasukan na to, pahinga siya, take a break muna for a while, para po, mas ma-express niya ang kanyang emotions at maiwasan na baka it may turn into a parang complicated form of grieving process.
Yeah, thank you for that, Doc Joan. Anything to add siguro, Doc Via?
I'd like to echo, no, yung sinabi ni Doc Joan, no, yung pagluluksa talaga, no, grieving is really a process, no, na kailangan nating pagdaanan, no, for us to recover, no, to process, no, the experience, no, not only with the way we responded doon sa nangyari sa atin, but also way din ito, no, para mag-connect, no, and to establish a stronger bond with the people who are around us, no. Yung gusto ko lang po idagdag, no, na kasi maganda yung sinabi ni Doc Joan, especially with how we deal with grief, no. Kung tayo man ay nasa proseso ng pagluluksa or meron tayong mahal sa buhay, no, na nagluluksa din, no, it's important for us to get through the process ng magkasama, that we're together, no, na in that period of aloneness, no, of loneliness rather, hindi tayo alone, no. And important dito yung support, yung support system talaga natin, be it our family or friends, no. So yung grief po, proseso po ito, no, na hindi minamadali, no, and we go through it, no, as a community, no, as a social group that is very cohesive doon sa ating pagpo-process ng ating experience.
Thank you very much for that, Doc V, no? So, given that mukhang ito yung area of concern, lalo na yung mga nagkakaroon ng quote-unquote mental health crisis, especially for our younger generation, I think perfect segue yun for our Alagang Hello Doctor. Yan, so this is
Doc Dex, you're on mute.
Oh, great. Thank you for that.
Na-excite masyado si Doc Dex.
Excited ako masyado. So, welcome to Alagang Hello Doctor. And in this segment, we promote the articles from our partner institution, Hello Doctor, which is part of the Hello Health Group that's present in over 9 countries. And of all of the health firms in the Philippines, they chose to partner with Alaga Health because we champion advocacy together. And for this week, we'll be highlighting this article from their website. So this article is actually pakita natin yung screen natin. So this is from the hellodoctor.com.ph website, Teenage Mental Health Crisis Red Flags to Watch Out For. Ang maganda po sa Hello Doctor, they're written by verify Doc Melissa Caraan, no? And I believe lumabas ata yung result ng diplomate exam today. Kaya I think si Doc Joan na late ng konti. Congratulations po sa mga new diplomates ng Philippine Psychiatrics. Very good. Very exciting. So, with that being said, ito tingnan natin siya, no? If you can look into the article itself, papakita yung mga red flags, so mga mood swings, strong emotions, and maganda mayroon pa siya mga infographics. And of course, discussions on the value of social connections, issues on academic performance, yung mga usual patterns na makikita mo lang kapag palagi kayong nag-interact, you are part of the support system or support group, and of course, time to seek help, no, pag kailangan na ng assistance, at kung saan pwede kumuha ng medical assistance. So very, very good articles from hellodoctor.com.ph, and you can even check out the rest of their website to view all of the other articles that they have on so many other topics. So again, for your medical information needs, you have your Hello Doctor. Then of course, sa mga gusto pong mag-sign up sa ating website, sa Alaga Health, for your health services, already available for download yung ating beta version sa App Store and sa iOS. So, with that being said, balik tayo sa next question before our very last segment for the evening. So, this question is coming from Ma'am Girly Santa Ana, and our question is, may kailangan po bang bayaran kapag gumamit ng Alaga Health app? Nakakahanap po kasi kami ng psych. So I'm not sure kung psychologist or psychiatrist. May subscription fee po ba? Nag-subscribe kasi kami dun sa iba dati pero hindi naman namin nagamit. Okay, so very quick question. May kailangan po bang bayaran kapag gumamit ng Alaga Health app? Meron po, pero depende sa kung sino po yung pipiliin yung health professional. Pero in terms of subscription fee, wala po. No subscription fee, free download, wala pong kailangan gawin. Of course, that gives you the power. Kayo mamimili kung sinong doctor yung pinakamalapit, pinakamura, pinakamabait, pinaka-cute, pinakamaganda. Lahat na po ng yun po yung pipiliin natin. So, you have the power to choose. So, pag nakita nyo yung si Doc Joan, ay si Doc Joan, sige, book natin yan. So, no problem po doon. And of course, if you're looking for a psych, we have some psychiatrists and psychologists on board. And hopefully you can subscribe to them or you can actually book their services. Kasama na po dyan yung kay Doc Joe na Healthy Mind Clinic. Yan. So hopefully you can download the Alaga Health app and check that out. And if you're a health professional, sign up to use the platform kasi may clinic manager na meron pang accounting system. Sobrang daling na po ng life, diba? So, with that being said, ako nang sumagot ng tanong, I think we can now move on to our special segment, which is of course, our Alagang Youth for Mental Health Coalition. So for this segment, let us bring back to the show Miss World Philippines Beauty with a Purpose, Miss Joy Barcoma.
Thank you, Doc Dex. Hi, Doc Pia. Hi, Doc Joan. Hello, Ymari. Thank you again for having me in this show and for giving me an opportunity to talk about Alagang Youth for Mental Health this evening. So for tonight, we'll talk about panic attacks, no? So we've discussed a lot of self-care procedures, tips that we can do. Okay, so I'm just fixing my camera. I'm just having a little technical difficulty here. But then, going back to what I was discussing, tonight we'll talk about panic attacks naman, no? So we have discussed a lot of self-care routines in the past, and tonight we'll talk about how to handle our panic attacks. So this is the last week of Mental Health Month, and for our sub-segment for tonight, again, we'll talk about panic attacks. We will share with you pieces of information about it, its symptoms and causes, prevention and seeking help for it, and how to help someone experiencing an attack. So, una, define muna natin, no? Kasi merong confusion usually between anxiety attacks and panic attacks. But for this evening, let's define panic attack. So, panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, and during which time 4 or more of the following symptoms occur. So, maraming sintomas tayong nararamdaman. No? Sometimes it's simultaneously happening within us nang hindi natin nalalaman if we do not know how to recognize that we are having panic attacks. So, ano nga ba yung sintomas, no, ng mga panic attacks? Kasi kailangan natin maging aware of the situation for us to be able to handle it carefully, for us to be able to handle it right, and of course, for us to be able to handle it if someone that we know, someone that is close to us is going through their attacks. So, ito yung mga sintomas, no? Unang-una yung palpitations, yung pagbilis ng tibok ng puso, yung pounding of the heart, or yung accelerated heart rate, no? Basta mabilis yung tibok ng puso mo. And then, second is yung sweating, or yung labis na pagpapawis kahit hindi naman mainit or kahit sobrang lamig ng kwarto, bigla ka na lang pinagpapawisan. Sometimes, that can be a symptom of panic attacks. Ano pa? Trembling or shaking, yung panginginig ng kamay, panginginig ng legs, panginginig ng katawan, that can also be a symptom of panic attacks. Pang-apat is yung sensations of or shortness of breath, no? Yung paghirap sa paghinga or yung feeling mo yung nasasakal ka, it feels like you're choking. Sunod is yung chest pain. Minsan nananakit yung dibdib natin, hindi natin alam kung bakit. We think that baka may sakit tayo sa puso, but sometimes, no, due to further diagnosis, if we decided to get help from professionals, it turns out meron lang pala tayong panic attacks. So minsan yung chest pain or discomfort could also be one of the causes or symptoms of panic attacks. Sunod is yung nausea, no, yung pagkahilo, yung feeling natin na susuka tayo, yung abdominal distress na parang hindi natin alam, parang may umiikot sa tiyan natin na hindi natin malaman. And for unknown reasons, bigla na lang natin nararamdaman. And yung the realization, yung feeling of losing your reality, no? Yung parang hindi mo na alam kung anong nangyayari sa paligid mo, or sometimes you can't distinguish kung ano ba yung realidad sa hallucination. And of course, yung depersonalization o yung pagiging detached mo from yourself. And also, yung pagkatakot, yung feeling of fear, no, of losing control, or yung fear of something that something might happen to you, something bad might happen to you, even if nasa sitwasyon ka naman that you are safe, no, pero you feel unsafe somehow. And of course, minsan yung pamamanhid din ng katawan can also be a symptom of panic attacks. So, nalaman na natin, no, kung ano yung mga sintomas ng panic attacks. There are lots of symptoms that can be seen if you're experiencing panic attacks. Ngayon, ano ba yung mga causes naman ng panic attacks? Because we also need to be aware of the causes for us to be able, no, para maiwasan din natin siya, para ma-address din natin yung problema. So, yung panic attacks, pwede siya makategorize as expected or unexpected, no? And yung common triggers natin, pwedeng genetics, pwedeng namana natin, pwedeng within our DNA, pwede din siyang psychological disorder. For example, you have anxiety, or you have bipolar disorders, you can have panic attacks, no? It depends really on your diagnosis. Minsan, pwede din tayo magka-panic attacks due to stress, hyperventilation, or yung sudden changes in the environment. For example, we have come across a situation wherein we feel uneasy, we feel unsafe or uncomfortable. Sometimes, because of that sudden change in our environment, nagkakaroon tayo ng panic attacks. Ngayon, what can we do, no? How can we seek for help kapag na-recognize na natin or nalaman or aware na tayo sa sitwasyon that we are experiencing panic attacks, no? Knowing some of the things might be able, knowing some of these things, pwedeng yung mga manonood natin, pwedeng makarelate, no? Due to their previous experiences. And it's really important to know that there are lots of contributing factors as to why we experience panic attacks. And sometimes it can also mimic other conditions. So we have to be wary, we have to be careful, and we have to be mindful also of our situation. So we encourage everyone, no, to consult their doctors for proper diagnosis and treatment. So to have a diagnosis, your doctor may request you to undergo physical exams, blood tests, heart tests. Ito yung sinasabi natin na almost some symptoms kasi are almost the same as the symptoms kapag meron kang sakit sa puso. Like me, I was diagnosed with a heart disease, mild vascular problem, and problema ko yung palpitation. So sometimes I'm having a hard time, no? Kung ano nga ba yung nararamdaman ko? Is it because of my heart problem? Or is it because I'm having an attack, no? Kailangan kasing ma-rule out muna, no? We have doctors here on board tonight to clarify this information, but the doctors have to rule out muna, no, yung possible medical conditions for them to be able to proceed to psychological evaluation. So the last thing that they do is psychological evaluation, wherein they diagnose a patient if they are having mental health issues, mental health problems, or whatnot. So you can speak with your doctor on how you can effectively manage your panic attacks, no, to decrease its likelihood para hindi na siya maulit or para mabawasan yung intensity niya, because we can always control it naman as long as we are mindful and as long as we know how to treat it. Speaking of treatment, no, paano ba natin magagamot ang ating panic attacks? So merong mga forms, no, ng pag-treat ng panic attacks, no. Yung unang-una is cognitive behavioral therapy, yung tinatawag nila CBT. Yung CBT is yung pag-identify natin kung paano tayo natitrigger kung saan tayo natitrigger kaya tayo nagkaka-attacks, no? And paano tayo magkakaroon ng healthy thinking patterns. I used to have my CBT workbook. You guys can message me if you want a copy. I used to work on my worksheets before to do the activities for me to be able to be more mindful about my emotions, about my feelings, and how to handle it effectively, more right, no? At para ma-handle ko siya healthily or in a healthy way. So we have the cognitive behavioral therapy, one of the ways to treat panic attacks. Second is yung exposure therapy. Dito naman sa exposure therapy, ang ginagawa nito is yung gradually ine-expose tayo sa mga sitwasyon na natitrigger tayo. Pero, yung sitwasyon na yun is much more safe and a controlled situation, no? And the third one is yung pag-practice ng relaxation techniques, yung such as deep breathing exercises, yung meditations, yung mindfulness, and of course, yung progressive muscle relaxation. So you guys can always search this on Google or ask your doctor, no, on how you can effectively do these things or practices. But always remember, no, meron din tayong fourth thing for treatment of panic attacks, and those are taking medications. But again, remember, no, to only take medications if your doctor prescribed it to you, no? Wag tayo magte-take ng medications just because we feel like it or just because ito yung ginamit ng kaibigan or kamag-anak natin. It is important to have our own and personal diagnosis with a professional para alam natin kung paano natin masusolusyonan, paano natin matitreat ng tama and effective yung ating sitwasyon. Ngayon, we have explained everything, no, for to a person na nakaka-experience naman ng panic attacks. Ngayon, kung hindi naman tayo nakaka-experience, ano yung pwede natin gawin para makatulong naman sa mga taong nakaka-experience ng panic attacks, or if ever we are faced, no, in a situation where someone is experiencing a panic attack in front of us. So, unang-una nating pwedeng gawin is to stay calm. Siyempre, hindi naman tayo makakapagbigay ng help if we are not calm, no? So, kailangan kumalma din tayo. Pangalawa, i-reassure natin yung taong inaatake or nagkakaroon ng panic attacks that we are there for them, no? And ask them kung ano ba yung pwede nating maitulong sa kanya. Although, we understand, no, sometimes they don't want to talk, they can't talk, they are unable to talk. So, we just have to be there, no, and assist whatever we can give, no, na help sa kanila for them to get better or to feel better. And third, alisin natin siya sa sitwasyon. For example, na-trigger siya because of the situation. Alisin natin siya sa sitwasyon na yun. Let us guide them, no, para ma-easen up yung feeling nila. Fourth, is to guide the person to have slow, deep breaths. Yun nga, yung practicein natin yung relaxation exercises or yung deep breathing exercises natin, yung inhale through the nose and then hold their breaths and then exhale through their mouths, no? Kasi yung pag-alam natin ng simple breathing techniques will be great help for those people who are experiencing panic attacks. And of course, encourage the person to relieve some stress by doing something physical. Galaw-galaw yung kamay, i-stomp nila yung mga feet nila, move their bodies, para na divert yung attention nila, no? And they can feel physically active, or they can be physically there for themselves, no? And of course, encourage that person to seek for professional help. We can only do so much for our friends. We can only do so much for our families and acquaintances. And the best that we can do if we cannot help them anymore is to direct them to the professionals, because professionals can do a diagnosis in which can help them now be better, feel better in the future, no? So panic attacks are abrupt surges of intense fear or intense discomfort that can happen to anyone. Wala siyang pinipili, no? It can be scary kapag naramdaman mo siya or kapag naranasan mo siya. But remember that there are treatments available, and remember that there are people who are willing to support you, no? So we encourage we encourage everyone or those people who are experiencing intense panic attacks to seek professional help and to have proper diagnosis and treatment. So remember that you're not alone and that you deserve support. If you're ever experiencing any panic attacks o kung ano mang problemang pangkaisipan or anything that you need help with, especially with your mental health, remember na hindi ka nag-iisa and that we are here for you. So if you're finding it difficult to access yung mga services, no, or yung mga na-try mo na before doesn't work for you, feel free, no, to send a message to Youth for Mental Health Coalition's Facebook page or mag-email po kayo sa info@y4mh.org and we'd gladly help and support you, no, of course with confidentiality, so we respect your privacy then, no, and always take our suggestion as inspiration in creating your very own self-care routine, no. Remember na yung mga self-care routines natin, yung mga pag-look after our well-being natin is individualistic, no? Hindi siya one size fits all. So, kailangan maging wary din tayo of that. And if you need to know more about mental health or self-care practices, check the social media pages of Youth for Mental Health Coalition. And just want to remind everyone that we have reopened our registration for membership. So, you may also reach out to us via info@y4mh.org for more details. So once again, that's it for panic attacks. I hope you guys have learned something from me. This has been a great evening to discuss how we can take care of ourselves. Again, always be kind to your mind and to other people's minds. Thank you so much, everyone. Have a great evening.
Thank you. Thank you so much, Joy. It's a pleasure to have you with us. And again, thank you for helping spark joy when it comes to mental health advocacy. So again, we have with us Doc Via, Doc Joan. I think Ymari has a bit of a connection problem, but thank you for being part of the program. As we enter the last phase, of course, yes, Ymari's back. The last phase of the program, which is of course our wrap up, or let's just call it Friday Night Delight. All right, so as a way to wrap things up, probably we can just ask everyone, including Joy, Ymari, Doc Via, and of course Doc Joan, for their final thoughts and messages as we wrap this episode with a beautiful bow. So maybe we can start with Joy very quickly, final thoughts and wishes, or probably kung meron kang upcoming appearances, time to plug.
Thank you so much, Doc Dex, Doc Via, Doc Joan, of course, Ymari, for sharing your Friday evening, no, to educate everyone who was able to tune into our live. And maraming salamat sa mga nagtanong. Maraming salamat sa mga nag-share ng kanilang problema, because we have to remember, no, that the first step in getting better is getting help. And we thank you for that courage that you have shown this evening. Maraming salamat sa ating lahat. And we're doing this, no, for our mental health.
Perfect. Thank you for that, Joy. And now let's jump to someone na inuubo pero still fighting. Let's go and jump to Coach Ymari.
Yeah, again, thank you very much, Alaga Health, for inviting me again. Thank you very much to our avid supporters and viewers na palaging every Friday and Saturday nakatutok sa Alaga Health Live and Happy Hour for Mental Health. And of course, no, tama yung sinabi ni Joy, no, I'm happy that a lot of people are asking questions because asking for help is never a sign of weakness. And syempre, Doc Dex, if pwede, no, I would also like to plug. So tomorrow, I'll be in Notre Dame of the Biyernes University General Santos at 12:30, 2 p.m. for Pangasinan Youth for Disaster Risk Reduction and Management, and at 3:30 p.m. for San Pedro City, Laguna, sponsored by Councilor Bernadette Olivares at 3:30 p.m. And also, we are on our second year for the National Youth Commission's Mental Health Youth Hub. We are preparing webinars, coaching sessions, and more for you this 2021 and 2022. And lastly, we make learning fun in Experto PlayLabs International Consultancy. So if you need seminars, training for mental health, leadership, and development, anything under the sun, don't hesitate to contact us because we provide fun, engaging, educational training all year round because every time we play, we also learn. Thank you, Doc Dex.
Ang galing. Thank you so much, Coach Ymari. Nako, busy-busy si Joy, busy-busy si Coach Ymari. Nako, I love mental health advocacy spreading like wildfire. So, let's go. Maybe Doc Via, final thoughts?
Grabe, Doc Dex. So, kung gaano ka-busy yung mga guests natin, inuubo na sila kaka-promote, no? And I'm very happy na that we have the younger generation, no? Joy and Coach Ymari actively promoting and actively fighting the fight for mental health. Doc Joan, hindi na tayo nag-iisa, no? Part na pala ako ng Thunders community, Doc, no? Groupmates talaga. Pero si Doc Joan is really, really my mentor, no? And I've really learned from the best ever since I was in college, no? That's why yung example nila Doc Joan have inspired me, and the examples of our young population have actually been continuing to inspire us to do shows, to do services like this, no, in Alaga Health, and of course our partners in Experto PlayLabs, no, to bring you quality information for mental health and well-being, no, and of course, no, if our young generation can do it, lahat po tayo merong role na ipa-play doon sa advocacy for mental health. So, ngayong patapos na po ang Mental Health Month, no, let's not forget the essence, yung gaano po kahalaga ang mental health, ang kalusugang pangkaisipan, di lamang po para sa atin, pero para rin sa ating mga mahal sa buhay. No? So, let's keep that in mind and let's celebrate mental health every day. So maraming salamat po. Magkita-kita po tayo ulit dito sa Happy Hour with Miss Ymari, Miss Joy, Doc Joan of course, and Doc Dex, no? And isa na namang masayang kwentuhan ng ating i-share, no, next week. Maraming salamat po. And tomorrow pala, Alaga Health Live. Yes. Check out.
And of course, to wrap things up with a beautiful bow, we have Doc Joan.
Hello! Parang feeling ko mauubo na rin ako. Na joke lang. Si Ymari talaga. Cute na cute si Ymari. Hello! Thank you very much once again, Dr. Dex, Dr. Via, and of course, hello, Joy. Congratulations, Joy. Grabe. Sobrang we are so proud of you, Joy, for your wonderful, great performance in Miss World. And of course, Ymari, hello, the younger generations na ngayon talaga. Tama si Dr. Via. Dr. Via, pwede na ako mag-retire. Joke lang. Pero really, we are now talagang very happy. And again, I'm really grateful to be a part of this very meaningful na program, all for mental health, kasi we know that there is no health without mental health. At lagi po natin tandaan na tayo po ay hindi tayo nag-iisa. Never po tayo. We are never alone. And help is always available po. At sana, nitong time po of our World Mental Health Month, let us all break the stigma, stop the stigma po surrounding mental health starting this month and beyond. So let's celebrate Mental Health Month every month beyond October. So ako po, I am really very happy that Dr. Dex and Dr. Via, no, talagang every week we are getting more mga questions and concerns from the viewers, and kaya po mas maganda keep your comments po and the questions coming kasi we are here po to help. Sama-sama tayo during this time of crisis or global health crisis po, pandemic. Sama-sama po tayo ngayon. Walang iwanan lagi. Kaya we are always here every Friday at 8 p.m. Thank you very much po.
Thank you, everyone. And that's it. That's Happy Hour for Mental Health, brought to you by Alaga Health Youth for Mental Health Coalition, Experto, PlayLabs, and so many other partners. And we will all see you here sa susunod na Biyernes every 8 o'clock p.m. because that is Happy Hour time. So once again, I'm Doc Dexter Galban, wishing you all a wonderful evening, and we'll all see you next week. Alagaan ang iyong kalusugang pangkaisipan para mas umunlad palalo ang ating bayan. Bye, everyone!
Hey!